Welcome to our MSU Extension Vaccine Project webinar on childhood immunizations. This session is designed to be an informal time where parents and caregivers can ask questions that they might have regarding childhood immunizations. I'm pleased to welcome Dr. Rebecca Shine to join us for today's webinar. I'll finish some housekeeping details and then I'll let her introduce herself further. My name is Carrie Schreier. I'm an extension educator with MSU Extension's Child and Family Development Work Team. I'm housed in Livingston County and I provide parenting and early childhood education information. I'm going to go ahead and hand the floor over here to Dr. Shine to let her introduce herself, and then we'll get going.
Thank you. Hello, I am Dr. Rebecca Shine. I am a doctor of pediatric infectious diseases, which means that I predominantly treat children who have infections or complications of infections. And vaccines in general are used to try to prevent children from having severe infections. I'm also an assistant professor in the Department of Pediatrics and Human Development, at Michigan State University.
Fabulous, thank you. Okay, so with that, I'm going to go ahead and get going. Again, if you're watching along on Facebook or if you're here on Zoom and you have questions, please go ahead and share those questions with us. We do have one question that we've got here to start with about the beginning of the new school year. So with kids getting ready to go back to school or maybe just having headed back to school, many parents and caregivers are wondering if their children are up to date on vaccines. Oftentimes, parents are aware that they need to do this, but maybe, why it may not understand why it's so important to stay right on top of these or to make sure that kids are up to date. Could you speak a little bit to the importance of making sure that children are up to date on their vaccines before the school year starts?
Of course. So in school is where children get most of their infections. Anyone who's a parent of a young child, especially if they've gone to preschool or daycare, knows that they come home sick very often. And schools are really breeding grounds. And the primary reason is that children are together for a long period of time in close contact. And that's how most infections are spread. So making sure that your child is up to date on their vaccinations before starting their school year is your best way to protect them against the common infections that they can get by being around other children. And it's the best way to keep them safe.
Great, thank you. Our next question has to do with, again, back to kids and shots, right? So my child has to get some shots before going back to school, but she's terrified of getting them. She's so scared of getting shots. What can I do as a parent to make shots less scary for my child? Is there anything that can be done to help reduce the pain of getting them?
Yeah, so it's a really common thing, especially for school age children, that they're afraid of getting vaccines. One of the things that's important to do is to talk to the doctor's office who's going to give the vaccine beforehand and tell them that your child is anxious, because there might be things that they have that they do to help distract children or calm them, or information they can provide you to help talk to your child. But other things that you can do is distraction is key. So bringing their like a device, like a tablet or a phone that they can watch their favorite show on, or a book that they can read or look at pictures in to help get them distracted during the shots is a good thing. Holding them on your lap and keeping them comfortable when you get the shots is a good thing. Sitting up is actually better for children than lying down. It creates less anxiety. They feel like someone's hovering over them when they're lying down. So having them sit upright in your lap or next to you when they get the vaccine can help. Also, stroking their arm right above the vaccine site can help too. It kind of deadens the nerve endings a little, and so you don't feel the pain as much. And then you can also give Tylenol afterwards to help with some of the pain.
Great, thank you. Those are some great tips. I didn't know that about stroking your arm. Okay, so the next question is about the COVID-19 vaccine for children. So my child's school is recommending that she get the COVID-19 vaccine before beginning to attend this year. It seems like the shot for kids is really new and maybe hasn't been tested enough. Is the COVID-19 vaccine safe for kids? And then why should we bother getting it if, their children have already had COVID?
Another good question. So the vaccine is safe for children. There have now been over 8 million vaccines given to children in the 5 to 12 years of age range. And there's only been a few minor complications reported. You might have heard about with the very first doses that we were giving to teenagers, there was some incidences of myocarditis. And we see that predominantly in teenagers, so mainly in teenagers, where they get some chest pain for a few days after the vaccine. It usually only lasts about 2 to 4 days, and it's easy to treat it with ibuprofen. That really wasn't seen in the younger children. In the over 8 million doses that were given, only 20 children had the myocarditis. Most of the side effects you're going to get with the COVID vaccine are the same that you're going to see with adults, which is you can get some pain or redness at the site of the vaccine. It's very common for your arm to hurt for a couple of days after the vaccine. And you may get some mild, like general body aches and fevers. All of those symptoms typically go away within 2 days. The reason that it's important is that even if you've had COVID, the natural immunity, which is your body's ability to fight off a second infection from having the virus, only lasts a few months. It lasts about 3 months on average. It may last a little bit longer in some people, and it may last a little bit shorter. So, just because you've had COVID doesn't mean that you're protected long term. And the vaccine immunity lasts longer. It lasts at least a year. We don't really know how long term it's going to last. And that's why there's a new booster coming out. But predominantly the reason for the new booster isn't because of waning immunity, meaning like the vaccine's not as effective, but because of the new variants. So the booster is dedicated to the new COVID variants that we're seeing increasingly now. And when you have COVID, you're only immune to that particular strain and not to any of the new variants. So the vaccine is also helpful because it helps protect you against more strains.
Great. Thank you. And actually, you are speaking right into the next question, which is about the boosters for COVID-19. And so this specific question that came in is, my son will be 13 years old in September, and my daughter will be 10 in November. Is it safe for them to get their booster shots for COVID?
Yes. So right now there's a booster recommended for children who are over 12 years of age. There is not a booster recommended for children who are under 12 as of this moment, but it may change. So if your child who is 13, it is recommended to get a booster. Now, if you have a child who has an immune compromising condition, and so there are a lot of them, but things like cancer or autoimmune disease would be the primary ones. And those children automatically should get 3 vaccine doses or an extra dose as part of their series. And they should automatically get a booster, regardless of age.
Okay, great. And keeping with our COVID conversation here, COVID vaccine conversation, we've had a couple questions come in about the safety of the COVID vaccine for younger children. One of them asking, specifically, is it a safe vaccine for infants? And then also just knowing that the number of people that have been vaccinated with the children's vaccine is a lot less. How might that affect our confidence of the safety in that vaccine?
There's a database that the government runs. It's called VAERS, which is the Vaccine Adverse Events Reporting System. All vaccine adverse reactions, as long as you tell your doctor that your child had that reaction, or the pharmacy or health department that gave the shot, they are required to report them to the Vaccine Adverse Events Reporting System. So we have huge records of all adverse events associated with vaccines, in addition to the records that the drug companies who make the vaccines create. So of course, the drug companies monitor their side effects, but this is an independent reporting and analysis system. So we have pretty good records to show that the vaccines are well tolerated. And like I said, there's been more than 8 million doses given to children under 12 years of age, and that's in the United States. If you add in data from Europe and Israel, or the other major areas that have been vaccinating children, we have way more than that. And the amount of adverse events in children associated with COVID is actually very low, much lower than even in adults. Now, I'm not saying it's impossible to have a bad reaction. And of course, if you have one, you shouldn't give your child additional doses. but it's very rare.
Okay, great. Thank you. Shifting our subjects here a little bit, the next question is about kindergarten vaccines. So my daughter needs to get her kindergarten shots. I noticed there are ones that she's had before. How come she has to keep getting the same vaccines again and again?
That's an excellent question. So most vaccines are given in series. So there are at least 2 doses for most vaccines. And it depends on the vaccine why they need multiple doses. Some of it is because one dose isn't enough to make sure that your body makes a good enough response. And the second dose will make sure that almost everybody's body makes good enough response. And some of it is because, just like with COVID, vaccines for other things the immunity that your body makes can fade with time. The big one that I think a lot of people worry about and think about is tetanus. So the tetanus, first, it takes 3 doses to get your body's immunity up to standard. And usually those are given to children in the first year of life at 2 months, 4 months, and 6 months of age. But if you get them later in life, you still need 3 doses to build immunity. After that, the immunity lasts for an average of about 10 years. And can wane after 5 years, meaning decrease. So if you poke your finger on a rusty nail and it's been longer than that, you could risk for tetanus, which is why we continue to give boosters. So we usually give them boosters before kindergarten, and then we give them boosters again in about 10 to 15 years of age and before they go off to college. And that's also to protect them, because it only lasts for about 5 to 10 years.
Oh, I didn't know there was another one around when they go off to college. I've got one leaving on Friday. So that's great information.
Well, it sort of depends on when they had their last one and how long.
Yeah, yep.
But if it's been more than 10 years, they get
timing wise, yep. Great, thank you. So the next question, again, kind of connects to that, getting these vaccines for, again and again sort of thing. So why is the chickenpox vaccine recommended for my 1-year-old? The vaccine was not around when I was younger, and I had a very mild case of chickenpox. I don't know anything about this particular vaccine.
That's another excellent question.
Why
so that vaccine has been around since the mid-90s. I believe it was approved in 1995, although I could be a little off on that, but somewhere in the mid-90s. Prior to that, people got chickenpox, and nowadays people don't really get chickenpox so much. The truth is that if a young child gets chickenpox, they usually do fine with it. The problem is that when adults get chickenpox, they can have very severe disease, and it can even be fatal. And if children who have cancer get chickenpox, it can also be fatal. And they can have bad problems with scarring, with pneumonia, and with meningitis. And so the reason we vaccinate against chickenpox is to prevent those side effects. And the way we do it nowadays is we do 2 doses, one at usually around a year of age and one just at 4 to 6 years of age, usually just before kindergarten, because this is another one of those that it takes 2 doses to really make sure that the vaccine lasts.
Okay, great. Thank you. The next question is slightly different than some of the questions that we've been talking about. It's getting a little bit more into some ethics and parenting questions. So you might not have a clear answer for this, which we can certainly do some research and get back. But the question is, I have an ethics question, possibly a legal question. If parents disagree on getting their child vaccinated, is it acceptable for one parent to go ahead and get their child vaccinated anyway?
Oh, I don't know if legally what the appropriate answer is to that. So I'm not sure that I can answer that. I mean, from a doctor's point of view, usually we just ask the parent who's there to sign for approval.
Yeah, from a parent educator perspective, my guess would be that it's whichever parent has medical power of attorney, that if you don't have medical power of attorney, but if you have joint medical power of attorney, then I think either parent could make that decision from a legal perspective. Right. Yeah, they're interesting questions when we delve further into some of these things. So let's see, where is my next question here? So if my child, and we've already talked about this a little bit, but if my child's already had COVID, why do they need to get that vaccine again later on? Don't they already have immunity?
Right. Well, so the vaccine against COVID, again, provides longer immunity, but there's something else I forgot to mention earlier. while children with COVID do tend to have more mild disease, which is great, they can have some very severe side effects. And one is the MISC, which is the multi-system inflammatory syndrome in children. And it's been seen some in adults too, but it's more common in children. And when it was first reported, there were children who died from the inflammation. Nowadays, because we know about it and we know to look for it, we've basically prevented most of that. But it's a very severe inflammatory syndrome. And the vaccine is 99% effective against preventing the MISC. It also gives you longer term immunity against COVID, and it'll help protect against some of the newer variants. So that's the reasoning behind getting your child vaccinated.
Great, thank you. Okay, so this is an audience question that's just come in. It's a little bit specific. Speaking about the measles vaccine, and the member says they had the titers done this year, and it was recommended that they get the measles shot again. Persons in their 30s, should they go ahead and get that shot?
Yeah, no, that's a great question. So nowadays we give two vaccines for the measles, mumps, rubella to children. We give one at around a year of age, and we give a second vaccine at 5 to 6 years of age. But that second vaccine we didn't used to give. So if you were vaccinated in like the 80s or early 90s, you didn't get the second vaccine. And the reason we give two now is because your immunity can decrease over time. And the real reason to get a repeat measles vaccine in somebody in their 30s is really not so much for the measles as much as it is for the rubella. Rubella is an infection. It's called German measles. And it is an infection that if you get it when you're pregnant, it will make your child incredibly ill. In fact, it will make your child basically a vegetable. And so the reason to get it is to protect future children.
Great, thank you. That's great information there. So our next question here is again about those back to school shots. My son needs several shots before going back to school this year. I would like to spread out the time during which he gets the shots so they don't overload his system. Can I delay some vaccines if I'm planning on getting them all eventually? And can you talk a little bit about the pros and cons of delaying vaccines, or why you should keep them together?
Yeah, great question. So first, vaccines, like the routine childhood vaccines, are actually tested in groups. So if we know we're going to recommend a vaccine to be given to 4-year-olds, it's tested in groups with the other vaccines that we give 4-year-olds before it is released to the public. So you don't really need to be worried that it's going to overwhelm your child's system in that sense, because we make sure that it won't before we release it. But that being said, there are definitely pros and cons of waiting or doing them all at once. Of course, one of the pros of waiting is that they don't get that many shots on one day, and you can space them out more. Also, if you have a child who tends to be allergic to things and you're worried about a vaccine reaction, spacing them out may help you identify which vaccine is the problem if your child has a reaction. Some of the cons to spacing them out is that there is sort of an order to them. Some of the vaccines can't be given directly after others. So when you give them together, it's okay. But if you wait, sometimes you have to wait longer before you can give them, or you need to give them in a specific order to make sure that you can get them within a timely fashion. There's also something to be said with the anxiety of getting vaccines, and getting them all at once, while it's a lot of shots at one day, may actually be less from an anxiety point of view than spacing them out and your child knowing that they have to keep coming back.
Yeah, that was certainly the case with my kids. It wasn't worth it to try to have to take them back again and again. They wouldn't have been happy. Okay, great. So shifting to our kids who are just a little bit older here, the school is telling us that it's time for my 11-year-old to get the HPV shot. This feels like it's too early for this person. They said they feel like it's too young for them to start getting vaccines like this, or to be thinking about having sex. There seems to be some concern here that this could promote promiscuity among teens. And this person's wondering if it's safe. They said they recall that there were some questions early on about the safety of that vaccine. And could you talk a little bit about that shot and why kids need it?
Sure. So I wouldn't think of the HPV vaccine as a vaccine to prevent sexually transmitted infection, because there are lots of strains of HPV. And some of the more common things that HPV can do in addition to being sexually transmitted is it's actually one of the common causes of warts. So it's also a shot to prevent warts, but predominantly it's a shot to prevent your child from having cancer. And you need to think of it as an anti-cancer vaccine. Is there anything we wouldn't do to prevent our children from having cancer? And this is something that can. HPV is one of the most common causes of cervical cancer, which can be very hard to diagnose and can result in late diagnosis and death. And so if we have a vaccine that will prevent that, is it worth it? That's really the thing. In terms of what age to give it, there are actually a few different recommendations. The American Academy of Pediatrics actually recommends starting at age 9. The ACIP, which is the board that sets all the vaccine standards, they're the ones that recommend starting at 11 to 12 years of age. The main thing to bear in mind is the number of shots. If you get your child vaccinated before age 15, it's 2 vaccines. If you get them vaccinated after age 15, it's 3 vaccines. So normally we would recommend getting them vaccinated earlier because it saves a dose and it works better. The current vaccine is not the first generation HPV vaccine. It's actually, I believe, the 4th. And it has been around since 2014. And it has been well established that it's safe. It protects against 9 strains of the HPV virus, including all of the most common causes of cancer and the most common causes of warts.
Great, thank you. It's a lot of good information there. This is, again, a little bit of a shift to what we've been talking about, but the question here is, if all of the other kids at school are vaccinated, why do I need to worry about getting my child vaccinated?
Yeah, so there's this concept of herd immunity, which means that if everybody around you is vaccinated, you're in a bubble and therefore you won't get sick. And that's true to the extent that it's true that everybody around you is vaccinated. But what we have learned is that the more people elect not to vaccinate their children, the more outbreaks of things that we didn't think we were going to see are popping up. So currently there's an outbreak of polio in New York City. Polio is a virus that we had thought we had almost eliminated worldwide. And there's currently a very large outbreak in New York City that they're having trouble getting under control. Polio will paralyze you, just like Franklin Roosevelt. It can also sometimes be fatal because it can make you stop breathing. Just prior to COVID, there was an outbreak of measles in Detroit. So, while it's true that if everybody else around you is vaccinated, your child is safe, it's also true that if everybody makes that decision, nobody's vaccinated and diseases we thought we had eliminated are going to come back.
Okay, great. Thank you. On that, how many vaccines kids are getting trend there. My kindergartner needs several shots before going to school. How come kids get so many more vaccines now than they did when I was younger?
So it is true that we have added vaccines over the years. And mainly vaccines are made against viruses, or in some cases bacteria, but mostly are against viruses that are known to cause severe disease. So if it's not something that's going to cause severe disease, they usually won't invest the effort that it takes to make a vaccine. It takes years and large quantities of money to develop a vaccine. So unless it's something that we think is going to be useful, we don't develop it. But, with improvements in vaccine technology, we're able to protect children against a lot more diseases, some of which were diseases that we would have gotten as children, like the Chickenpox vaccine. So there are more vaccines out there now to protect against severe illnesses.
Great, thank you. Jumping forward a few years here, more than a few, my child is heading to college in the fall. His school does require the COVID vaccine, but no other vaccinations are required. What other vaccines do you recommend for college age students?
So in general, making sure that your child has received all the vaccines that they were supposed to have received up to that time, which we call being up to date on your vaccines, is all you need to do, because all of the vaccines that we would recommend for going off to college are really included in those standard vaccines. But if they haven't received them in a while and you just want to specifically pick ones that are good for going off to college, the meningitis vaccine is a really important one. There actually are 2 meningitis vaccines out there. One of them protects against 4 strains of meningitis, and that's the one that's routinely recommended. And then the other one protects against 1 strain of meningitis, and it's recommended in certain situations. So that's a discussion with your physician. Also, the tetanus vaccine, if they haven't had a recent one, because you just don't want them to step on a nail or something and have a problem when they're outside of your house. And then the vaccines against hepatitis B, because that is a sexually transmitted disease. So meningitis, the 2 vaccines, tetanus, hepatitis B, those are really the big ones that we recommend before school.
Okay, great.
Before college.
Thank you so much. So the next one, again, speaking of those school recommendations, my child's school is recommending that they get a flu shot each year. In the past, I haven't had him get one because it seems like I always get the flu right after I get a flu shot. Can you get the flu from the flu shot?
So it's very common to get cold-like symptoms after the flu shot. It can definitely cause some achiness and soreness in your arm and overwhelming muscle aches. Those are actually pretty common complications of all vaccines, like they're common side effects after any vaccine. Those symptoms usually only last about 2 days, and Tylenol can help. They're not actually the flu. Well, it may feel like it. They're not technically caused by the flu. They're caused just by the vaccine, and you can get them from anyone. You can't actually get influenza from the shot because the shot is a killed vaccine. There's no live virus in it. There is also a nasal flu vaccine, and that is what we call an attenuated live virus. So there is a small chance of getting flu from that one, but it's very low.
Okay, great. Thank you. The next question is regarding those rates of vaccines. I read that many Michigan counties have low vaccine rates now after the pandemic. Is it safe for my child to go to school if the other kids aren't vaccinated?
Well, if you vaccinate your child, then they're as protected as they can be. And so therefore, it's much safer for them to go to school. If they're not vaccinated, then if there is an outbreak of a vaccine preventable infection, then they are at risk for it.
Now, the first part of that question was, I read that many Michigan counties have low vaccine rates. Are you seeing a reduction in how many kids are up to date right now in Michigan?
There's been a reduction. I'm not super familiar with all of the county numbers at this point in time, so I just want to make that clear. But there definitely was a reduction in access to healthcare, especially at the beginning of the COVID pandemic, when everybody was sheltering in place. First of all, we didn't actually really see any circulating viruses, which was kind of amazing. It just goes to show you how much being out and around people really does spread infection. But there was just decreased access to healthcare in general. So many people missed a lot of their normal well care.
Great, thank you. Okay, our next question is going to be a little bit about reactions to vaccines here. So the last time I got my child a vaccine, he had a reaction to it. Am I supposed to keep giving him vaccines, and how do I know that they're safe?
That's an excellent question. And a lot of it depends on what the vaccine was and what the reaction was. So there are certain common side effects that are known to happen after a lot of vaccinations. The infant vaccines, it's very common for children to have a fever that night or sometimes the next morning. A lot of the vaccines we receive later can cause some what we call site reactions. So they may cause a little redness at the injection site. They may cause sore muscles at the injection site. The tetanus vaccine especially will make your arm pretty sore for a few days afterwards. And they may cause some general achiness or just not feeling good feelings. Most of the time, those symptoms go away within about 48 hours. If it was a more severe reaction than that, then you need to really talk to your doctor about what the vaccine was that caused that and what the reaction was. And it may say that you can't get your child more doses of that particular vaccine or vaccines that may contain some of the same components.
Okay. So sticking with those questions about reactions, what would be considered like a mild reaction versus something that you might need to actually get medical attention for?
So basically everything that I've mentioned, some redness or soreness at the site, some muscle aching in the limb that received the vaccine. I keep saying arm, but in young children, that's often legs because we usually give it in the buttocks or the thigh. So in the limb that get the vaccine, and some general achiness that's gone within 48 hours. If you have anything more severe than that, an anaphylactic type reaction where you have swelling of your lips or tongue, of course, that would be a serious reaction. A rash could be considered a serious reaction depending on the rash. If they're doing anything that you find concerning, then you should certainly report it to your doctor. Now, like I said, there's that vaccine adverse events reporting system, and any reactions that happen within having very shortly after having a vaccine, even if it's a normal childhood process, do get reported. So example, with the COVID vaccine, there in children 5 to 12 years of age, there were 2 reports of children who had appendicitis afterwards. Now, most likely they had appendicitis because they were going to have appendicitis, but all of those things end up getting reported.
All right, great to know. All right, this is a little bit of a different subject that we've been talking about. Do my kids need the monkeypox vaccine? Is this something we should be concerned about for our children?
So in general, you really don't need to worry about monkeypox. Now, there is definitely an outbreak and it is definitely spreading, but it's predominantly spread with direct skin-to-skin contact. So if you come in contact with somebody who has a rash, now it's we call a vesicular rash, so it looks like little blisters. They're very round blisters and they should be kind of even in appearance and they should all look about the same. If you come in direct skin contact with somebody who has a blistering rash like that, then yes, you need to seek medical care. But if you don't, then you don't really need to worry about it because it's really only spread by contact with the rash. It's mainly being spread through intimate activity because that's when you would most come in contact with somebody else's skin that has the rash. And so that's like really the primary concern. Could you spread it to your child if you have it and you're holding them? Yes. You can also spread it to pets and animals when you snuggle with them or hold them. So if you have a rash like this, the best thing you can do is seek medical care to get it diagnosed, keep it covered, and then avoid close contact. It's also summertime. And one of the big viruses that we see in the summertime is the enteroviruses, and they can cause something called hand, foot, and mouth, which is also a blistering rash. So just because your child has a blistering rash doesn't mean it's monkeypox. This time of year, it's most likely hand, foot, and mouth. And you really only need to worry about it if they've come in contact with somebody else who's known to have monkeypox.
Okay, great. On that monkeypox conversation, I've heard that kids are protected from monkeypox because of the chickenpox vaccine. Is that true?
So monkeypox is not actually related to chickenpox. Chickenpox is part of the family of viruses that we call the Herpetiviridae family. And so there are other viruses that are related to chickenpox, but monkeypox is not. What monkeypox is related to is actually smallpox. Now, we stopped giving smallpox vaccine in the United States in 1973. So if you were born before 1973 and you received a smallpox vaccine, then you have some partial immunity to monkeypox. Also, cowpox virus, which is mainly common in people who have close contact with cows, like milking cows or caring for cows, also provides some immunity for monkeypox. So if you have had cowpox in the past or you were vaccinated against smallpox, you have immunity. But most children in the US do not fall into those categories. So if they were exposed, you would need to get that identified and contact the health department, and they will provide vaccine.
Great, thank you. Next question is about the flu shot. I know that the flu shot is sometimes available as a nasal spray. Why aren't more vaccines offered like this?
It's a good question because nobody likes getting shots. The flu shot, the nasal flu shot is a kind of unique thing. It's what we call temperature regulated. And it is set to live at 2 degrees lower than body temperature because your nose is about 2 degrees colder than your central body. It works because of the area that flu is. Flu mainly comes in through your nose, and that's why the vaccine works there. Other infections that don't come in through your nose, we can't use nasal vaccines on. Now, there are other vaccines that aren't shots. The most common one that's part of the childhood series is the rotavirus vaccine, which is it's liquid. You take it by mouth. And then there's also the cholera vaccine, and the typhoid vaccines are both oral as well. They're both pills that you swallow. Usually you wouldn't have come in contact with those unless you're traveling abroad. But those all work as pills because the infections come in through your intestines. But the problem is a lot of infections don't come in that way. They come in like through your bloodstream, and that's why we can't give them that way.
Great. I remember taking those vaccines and being surprised that they were pills when I was getting ready to travel in college. So you mentioned earlier in the webinar that there was a measles outbreak in Detroit. And of course, we also talked a little bit about the polio outbreak in New York. Can you talk a little bit about how outbreaks are got under control? Like what would that look like?
Well, that's more the health department than me. But usually the way that outbreaks are got under control has to do with outbreak tracing. And we were doing some of this at the beginning of COVID, but then the numbers became so big so fast that it wasn't really effective. But what they do is when you identify a case, the health department will contact you and find out where you may have gotten it from and anybody else you may have been in contact with that you might be able to spread to. So if you develop any of what we call reportable diseases, and there's a list of them on the health department website, you will get a phone call from somebody who works at the health department, and they will ask you a bunch of questions. And then they will try to contact your, associates and see if they can figure out where it came from or prevent further spread.
Great, thank you. So this question is a little bit more on that kind of parenting lens of things. How do you explain to kids that they need shots if they're scared or confused about getting them or why they have to get them?
Yeah. So there's a number of children's books and things that can help with this. And I don't know that I have a list of them, but your pediatrician's office probably has some pamphlets and things that can help too, where they kind of talk about it. There's also some good TV shows. I believe things like The Magic School Bus has done an episode on this too, where they kind of talk about it. But really the thing you want to make sure that your children understand is that you're doing this to protect them, to keep them safe for the future. And that, yes, the shot itself isn't fun, but it will protect them and keep them safe. And that's what your job is as a parent.
Great, thank you. This next question is really interesting. Are there specific vaccines that kids would need to get to travel that are different from the school vaccine or their regular vaccine schedule?
Yes, there are. Now, the thing about travel vaccines is for the most part, they're not paid for by insurance. So you do have to pay for out of pocket for them. There are a couple of places that you can get them. Usually your local health department will have some of them, but like I said, you have to pay out of pocket for them. And then there are travel clinics that exist in areas. We have one at MSU that will help you get the vaccines that you need to travel. Most of the vaccines that are needed for travel are approved for children either 6 months or a year of age and up. Things like yellow fever vaccine, where you might need to travel to certain places. Now, the way you figure out what vaccines you need is either by going to one of those 2 places and they'll look it up for you, or the CDC's webpage has something called the Yellow Book, and you can type in CDC travel and tell them where you're going, and it will give you a list of the vaccines that you need. And that's actually where we look it up to. And it's open to everybody. It really depends on where you're going. If you're going to, say, Western Europe, there's really nothing additional you need to get. If you're going to sub-Saharan Africa or the Amazon, then there are definitely other things you need.
Yeah, that's interesting. The MSU Travel Clinic was very helpful for me when I traveled, but that was before the internet. So I wasn't able to Google things or find them on the CDC's website. Mm-hmm. Great, thank you. Next question here is about the safety of vaccines. Could you talk a little bit about how or if vaccines are tested for safety?
Yes. So all vaccines go through a 4-step process. of safety testing. So the very first thing that you do when you're testing a new vaccine is test it for safety in a small group of people. So that's usually healthy people that have volunteered to get the vaccine and see what happens. And that's the very first thing they do. And if it fails that, it doesn't go any further. And we call that a phase 1. Then the next step is a phase 2 trial, where they give it to a larger group of people. At this point is when they're actually first starting to look to see if it does what we think it should do. Because the very first step, they don't even look to see if it does it. They just look to see if it's going to cause any problems. So the second step is what we call a phase 2 trial, where they look to see if it does what we think it can do, and they continue to monitor for safety. And then there's a third part in the series, which is the phase 3. This helps narrow down dose. It also is predominantly for safety, because basically it's the same as the phase 2 trial, but they give it to more people, because sometimes you may not see a problem if you only give it to 10 people. But if you give it to 100 or 1,000 people, you may see a problem. And then finally, after it gets approved, there's the phase 4. And the phase 4 is like that vaccine adverse events reporting system, where everybody who gets the vaccine, any adverse events get reported. And so the safety data continues to get monitored. And sometimes recommendations change. There have been vaccines that have been approved and then were pulled when they noticed that there was problems. So it is a constant process of monitoring safety. And safety is really predominant, like the main thing that they monitor. And on average, it takes 10 to 12 years for a vaccine to get approved. It happened faster with the COVID vaccine because we needed it to happen faster. But the components that are part of the COVID vaccine have been studied since the 80s. So they've been around for about 40 years. The concept of the vaccine was not new, and a lot of the pieces are already been tested. The only thing that was different was adding in the specific components for COVID.
Okay, great. Thank you. This is a great question. I know it's affecting a lot of parents right now. What should I do if my pediatrician can't get us in time to stay up to date on my kids' vaccines? Will it cause a problem to get like a little bit behind if you're waiting for that appointment to get in?
It's actually, again, as what we were talking about earlier, since COVID, a lot of people are behind. It's a lot harder to get appointments. And a lot of pediatricians' offices have gone to having kind of healthy and sick children come on different days or different times to avoid spreading infections. So it's a definite problem. In general, it's not a huge deal to delay a little bit in order, to wait to get the appointment. But that also might speak to like not waiting to get getting all the vaccines that you need in on the same day rather than waiting, because it may take longer to get you in to get some of the other components.
All right, great. Thanks. This is a question that had come up a fair amount actually as we were marketing this program and talking about this program. I've heard that the COVID vaccine alters your DNA or kids' DNA. My friend said that it's actually considered gene therapy because it's altering DNA. Is this true? And if it is or is not, are there other vaccines that do alter DNA?
It doesn't actually alter your DNA. The reason that that's thought is because the COVID vaccines, the Moderna and the Pfizer, are using what we call messenger RNA. And the way your body works is it has DNA that it converts into RNA. And there's actually different kinds of RNA it makes. There's 3 different kinds. And those RNA are what give your body instructions to do all the things that it needs to do. The messenger RNA is exactly that. It's a messenger. It's a messenger from your DNA to other parts of your cells to give it an instruction panel. It works sort of like those notes that they give James Bond that explode after he reads it, where it really isn't good for very long. It's a non-binded piece of RNA. It doesn't attach to anything. Once it gets read, it falls apart. It really is only lasts in your body for a few hours. It's just a spreading of information. Your body then takes over and makes the antibody based on the information in the messenger RNA. But that piece of messenger RNA itself doesn't last in your body at all. And so it can't really do anything other than give your body instructions to make an antibody to protect yourself against the vaccine. All of the other vaccines that we have on the market right now are do not work as like that at all. They're either parts of the virus or bacteria that are broken down in a way that they can't cause disease, that your body then makes its own antibodies to, which is what most of them are. That's really what all of them are. They fall into different categories. There's ones that are pieces of toxin. There's ones that are the virus itself, but the virus is dead. And there are ones that are just components of like the surfaces of the viruses, sometimes attached with other things so that your body will make a better response. But they're really just dead pieces of the infections. There's no RNA or DNA involved.
Oh, that's really interesting. On that subject of COVID vaccines, the next question is about how parents should decide which COVID vaccine to give their child. So is there one COVID vaccine that's better than another? And now I'm hearing that there's a third option. I'm just really not sure how to choose which vaccine.
Okay, so the only ones that are approved for children under 12 years of age in the US are the Pfizer and the Moderna. And really, you should give them whichever one is more available. There is some slight differences. The Pfizer vaccine is an extra dose, but it may be slightly more effective. The Moderna vaccine is one less shot, but it may not be quite as effective against preventing disease, but they're equally effective against preventing hospital stays, severe disease, and MIS-C, which is really what you want to prevent. If you've made COVID into just a mild cold, then it's something that's not going to cause too much problem. And that's really what the vaccines are for.
That's great. Thank you. Flipping back to the subject about the polio outbreak in New York, I've heard about the polio outbreak. Are our kids protected from this strain of polio with their current childhood vaccines if they're up to date? And then should we avoid traveling to New York at this time?
If you've had all of your polio vaccines, which the last one is given usually around school entry, so 4 to 6 years of age, then you should be protected. All of the cases that I'm aware of have been in people who are not vaccinated. If you have not been vaccinated against polio, then you should not travel to the New York area without being vaccinated.
Okay, great. So a slight shift here, since masking is less common now, is masking something that kids should do if they're fully vaccinated? Or are there certain spaces where kids or families should still be masking, even if they are fully vaccinated?
That's an excellent question. And some of this is going to be up to your personal willingness and to take risk. So COVID is now endemic, meaning it's around us and there's going to be people with it in any sort of crowded situation that you go into. The health department and the CDC both publish rates currently around you. And so we can know how much is circulating around us right now. I believe we've been in the low to moderate area currently. So there's a little bit more virus circulating right now, and it'll probably go up slightly after school starts as people get put together in closer situations. In general, if you have an immune compromising condition and the rates are moderate to high, then it is absolutely recommended that you mask, especially indoors in close contact. If you're outdoors, if you're going to be in a tight crowd, then we would still recommend masking. But if you're outdoors and separated from people, then it's not really necessary. If you are immune competent, meaning you have a normal, healthy immune system, then we really recommend masking indoors only when the rates are high.
All right, great. I have heard you mention the word endemic a couple times. Could you talk about the difference between a pandemic and an endemic?
Yeah. So a pandemic is what COVID started as, whereas it didn't exist and it spread across the whole world, every place in the world, actually. And so that's something that wipes through. Flu becomes pandemic, influenza becomes pandemic, usually every 5 to 6 years, where it kind of spreads through and causes major changes. The last big outbreak we had was in 2009, when we went from one strain of flu to a different strain of flu. We went back to the H1N1. And so there was major widespread hospitalizations and illnesses. It also becomes pandemic, usually for a few weeks to months and every winter, where there gets widespread disease, but then it goes away. endemic is a virus that or infection that lives in the area at all times and can always cause disease. And COVID at this point has become endemic, meaning we're not at this point going to eradicate it. It's going to be around.
Great, thanks. Well, my next question here, we're just about done, but we have time for just a couple more. On that subject of the flu, do you think that COVID is going to be like the flu, that it's going to come and go seasonally like we see the flu?
It's really hard to say because it's early, but it seems like that's going to be the case. And there might be additional boosters or vaccines that are recommended due to new strains. Like I said, there's a new vaccine that's being worked on that should be out in the next couple of months that's against the two strains that seem to be circulating most now. It's to Omicron B and C or something. They have names and numbers, and I'm sorry if I can't remember them off the top of my head. It's like B135 or something. So those, like that may be kind of the case, but it doesn't seem like we're going to ever be able to really eliminate COVID from everybody. The only way to do that would be, like, at this point, I just don't think it's possible, but potentially if everybody in the entire world was vaccinated, which seems unlikely.
Yeah, great. So just, I think maybe about two more here. The next question is about, again, those numbers of vaccines. I would like to limit how many vaccines my child gets. Are there some vaccines that are more or less important than others? Or how do you pick through which ones to get?
Well, of course, the vaccines that we recommend are all important, but there might be things that your child would be more or less likely to come in contact with. In general, the vaccines we recommend them because they're important. There are a few that have a little bit more questionable recommendations behind them. Like I mentioned, there are 2 meningitis vaccines, but the meningitis B vaccine isn't necessarily indicated for everybody. The hepatitis A vaccine is maybe one that is less important unless you're going to travel abroad because it doesn't usually exist in the US. But then again, infections have spread. So it's hard to say for sure that something isn't important just because we don't currently see it in the US. And certainly if you're someone who takes your children abroad, then the hepatitis A vaccine would be a very important one.
Great, thank you. Well, we're going to wrap it up with just one last question, and then you're welcome to share any other final thoughts you might have. This is a good concluding question. What might you say to people or parents who are hesitant to get their kids vaccinated?
Well, I think it depends on why you're hesitant. And so I think I would recommend that you talk to your doctor about what your concerns are and, let them address them. And, some of your concerns, it really depends on what your concerns are. And I think the best thing you can do is talk to your doctor and kind of go through all of your concerns and make sure that they're well addressed. And then reassess, think about what you learned and make your decision.
A second to thank you, Dr. Shine, for joining us today. We very much appreciate your time and willingness to run through a whole lot of questions there. Do you have any other thoughts or final information you'd like to share before we wrap up today?
Just in general, the vaccines are considered safe, and they're really the best way that we can protect our children against things that could happen in the future.
I do want to draw your attention. If you're not following us on Facebook, we do have a couple ways you can join our work on social media. This page, the Facebook page at My Stronger Family that some of you saw marketed for this, that's MI Stronger Family, is our parenting and family education page. We have another page called My Health Matters, which is our nutrition and physical health and wellness page. And then we also have a page for our Michigan Vaccine Project that you're welcome to join. We are going to be offering webinars like this monthly, so we look forward to your popping in and joining us.